Hello, good afternoon. Today's class is on psoriasis. Right? Psoriasis is one of the most chronic dermatological problem, and it's a very common problem. अनि एकदम कमनली नाम थाहा भएको प्रब्लम पनि हो. त्यसैले कति पेशेन्ट्सहरूले सामान्य लिजनलाई पनि यो psoriasis हो भनेर आइरा हुन्छ. Sometimes it is psoriasis, sometimes it is not psoriasis. अनि psoriasis को बारेमा धेरै मिथहरू पनि छ. People think psoriasis is something very dangerous and धेरै mythहरू पनि छ. So today in this class we'll deal with how to recognize psoriasis. Psoriasis मा के हुन सक्छ, psoriasis लाई कसरी चिन्ने, psoriasis सँग associated अरु के चीज हुन्छ. We'll try to recognize the skin lesions of psoriasis, associations of psoriasis, who has higher chance of having psoriasis, but we will not deal with the treatment part of psoriasis. Treatment say हामी भोलि deal गर्छौं र as a good class is mostly going to be concerned on how to recognize, what is the classification, what are the causes, all this of psoriasis, right? So psoriasis ko pathogenesis, these are it's multifactorial in nature. Psoriasis भने diabetes, hypertension, जस्तै it's like multifactorial, exactly you भन्ने चाहिँ छैन, but there are many things that play a role in it. There might be genetics. So people who have psoriasis, there's a chance, around 30% chance that their children will also have psoriasis. But all the people who have psoriasis, just because they have somebody in their family with psoriasis भन्ने छैन. तर अब घरमा कसैलाई psoriasis छ भन्ने चाहिँ there's a higher chance that the other family member will also have psoriasis. There's a particular gene loci of psoriasis which is known as source1 gene, and that sort of determines the probability of having psoriasis. But all people who have psoriasis, उहाँहरुको सबै family members लाई psoriasis हुने सम्भावना हुन्छ भन्ने चाहिँ होइन. De novo पनि arise गर्न सक्छ, but genetic predisposition is definitely there. Then there are certain drugs also which can cause psoriasis. Some of them are used in psychiatry, like lithium mood stabilizers or huncha. HCQ, hydroxychloroquine, chloroquine, anti-malarial drugs are psoriasis like exacerbate गर्न सक्छ अथवा start गराइदिन सक्छ. Antihypertensive drugs like beta blockers can also start psoriasis. Infections, there are some infections which can predispose certain types of psoriasis. But this doesn't mean that all these things cause psoriasis. They are just predisposing factors. It is multifactorial. अब कोही-कोहीमा कुनै-कुनै चीजले सुरु हुन्छ, कुनै-कुनैमा कोही-कोही चीजले सुरु हुन्छ, but these all have been linked with how psoriasis starts. त्यो बाहेक stress भयो, alcohol भयो, smoking भयो. Smoking, drinking and stress, these all tend to exacerbate psoriasis. So and obesity also. Obesity सँग त एकदमै diabolical relationships. People who have psoriasis tend to be obese, and obese people tend to have psoriasis. So these are various factors that sort of exacerbate, initiate psoriasis in people. And now genetics for people who have psoriasis, there's a strong genetic component, and most of them have a strong family history, almost 90%. But all the time they might not be sure it is psoriasis or some other skin disease, but most of the patients will tell that there is some kind of skin disease, mostly in the family. And in twins it is seen that 90% concordance is seen in twin studies. So there's source1 gene, I think it is like 35 to 50% heritability also. So if someone has psoriasis, usually 35 to 50% chance that it is inherited, but there is also chance that it is not inherited. It can start de novo as well, and it's a very complex disease, and it can be because of the interplay of the genetic loci in various centers. But the most important gene is source1 gene, and that is often asked in MCQs. Environmental factors, physical trauma once, right? Trauma, what you should remember is a word called cobnarization. Now this is what is known as cobnarization. There are certain diseases which shows Cobner's phenomena. One of them is psoriasis. अर्को एकदम common example बना lichen planus. अर्को बना vitiligo हो. यो पहले कहीं सोच्छ what is Cobner phenomena and what are the diseases that shows Cobner phenomena, and diseases like psoriasis, lichen planus, vitiligo, these show Cobner phenomena. Cobner phenomena मा चाहिँ के हुन्छ भने एउटा ठाउँमा स्किनमा psoriasis छ, सपोज कसैको नीमा psoriasis छ, तर जिउको अरु कुनै पनि पार्टमा केही इन्जुरी भयो, maybe it's a scratch, maybe it's a accident, maybe any kind of injury. If any kind of injury happens in another body area, the psoriasis lesion tends to develop even in that body area. So yeah, your ठाउँमा scratch marks mostly अब के itching गरेर scratch गरे होला, तर त्यो scratch गरेको सबै linear lesions-हरुमा चाहिँ psoriasis को plaque develop भएको छ. So this plaque or this psoriasis can develop in sites of injury. It can be as short as 3 days or as long as 2 years. So injury as an environmental factor, injury it can be like proper injury where epidermis is completely damaged, or it can be just a scratch. All this minor to major injury भएको ठाउँमा चाहिँ त्यो खाले lesion develop हुन्छ अनि त्यसलाई Koebner phenomena भन्छ. And Koebner phenomena is seen in psoriasis as along with some other diseases. जस्तो lichen planus भएको मान्छेमा पनि एक ठाउँमा lichen planus छ भने अरु ठाउँमा injury हुँदाखेरि scratch हुँदाखेरि त्यो ठाउँमा lichen planus को lesion develop हुन सक्छ. Same with vitiligo. So what you should remember is a phenomenon known as Koebner phenomena or Koebnerization, and the diseases in which we see Koebner's phenomena and what happens in Koebner's phenomena, right? Any drugs. So there are certain ingestion of certain drugs can lead to drug-triggered psoriasis, as I've already told you before. Mood stabilizers, so lithium beta block, antihypertensives like beta blockers, antimalarials like hydroxychloroquine. And nowadays you guys have heard a lot about hydroxychloroquine. People were taking it initially prophylactically even for COVID, but now it is no longer being taken. But even HCQS, this hydroxychloroquine, they can predispose psoriasis in certain group of people. Simple NSAIDs, which we take over the counter, antibiotics like tetracycline, all these drugs can trigger psoriasis in certain individuals. Especially tonsillitis, throat infections, in those children, Streptococcus pyogenes infection can trigger psoriasis, and that form of psoriasis is very typical, and it is known as gutted psoriasis. Okay. So we have a picture of gutted psoriasis in coming slides. So gutta is like shower of rain. So shower ko rupma aune sano lesions all over the bodies are seen in children who have had preceding infection, throat infection. So that form of psoriasis is known as gutted psoriasis, and it is preceded by throat infections. Metabolic syndrome and psoriasis. Right? So you guys all know metabolic syndrome, hypertension, low HDL, high triglyceride, obesity, insulin resistance. So together they form what is known as the metabolic syndrome. Now metabolic syndrome and psoriasis, it has a relationship where metabolic syndrome tends to increase psoriasis and psoriasis tends to exacerbate metabolic syndrome. So people who have psoriasis, they are encouraged to decrease your obesity, control your cholesterol level. So get out of the old metabolic syndrome effect so that the psoriasis also becomes less severe in those people. Psoriasis metabolic syndrome the severe, either it predisposes predispose psoriasis like, otherwise psoriasis पनि अझै severe हुन थाल्छ, exacerbate हुन थाल्छ. त्यसैले गर्दाखेरि it's the relationship is pretty strong between metabolic syndrome and psoriasis. People with psoriasis should be advised to decrease their weight, decrease their stress, be more cautious of what they eat, how they exercise, and other related factors. So, as I've already said, several reports indicate that there's an association between psoriasis and metabolic syndrome, but it remains unknown whether obesity is causing psoriasis or psoriasis is causing obesity, because it is seen, bilaterally connected. Our clinical presentation, clinical presentation. So we'll see each of their pictures. So there's plaque psoriasis, plaque one. As you remember, it's like a lesion which is raised, elevated. So this is a classical lesion of psoriasis, is a plaque psoriasis lesion. So we'll see the picture. Gutted so throat infection psoriasis, there's a gutted psoriasis. Flexural psoriasis is also known as inverse psoriasis. Flexors psoriasis. Hypertrophic is another variant. Erythrodermic erythrodermic, like the whole skin becomes red, top to bottom, everything becomes red. So that is an erythrodermic variant of psoriasis. Pustules psoriasis, right? Pustular psoriasis once, right? So this is the most classic picture of psoriasis. So everybody, when you are asked to describe a lesion of psoriasis, this is what people expect you to describe. The lesion is a plaque, raised lesion. भन्छ. So it's a plaque which is having this reddish hue, like salmon pink color pani bhन्छ, light pink color or salmon pink color bhन्छ, and their scales are present. Now these scales have a very typical description: silvery white scales on a salmon pink surface on a raised plaque. This is like the typical description of psoriatic lesion. And a classical psoriasis को plaque से looks like this. Usually इसको body area से typical हुन्छ, scalp मा देखिन्छ, इसको elbows मा देखिन्छ, knees मा देखिन्छ, natal cleft मा देखिन्छ, umbilicus मा देखिन्छ, genital area मा देखिन्छ है. Commonly अब मान्छेले धेरै देखाउन मिल्ने नोटिस गर्ने ठाउँ भने चाहिँ यो elbows भयो, अनि knees भयो, अनि scalp area अनि ears तिर पनि typical यस्तै खाले pink plaque with scaly on top, right? So this is a typical picture of how psoriasis looks like. Now in this picture you can see that there are multiple plaques of psoriasis all throughout the body, and these plaques show this salmon pink hue, but these plaques are not showing that silvery white scales is small comes up to, either because the patient has just initiated treatment or the patient is recovering, या त भर्खर सुरु भइरहेछ लेजन, या त रिकभर गरिरहेछ, त्यसरी स्केल्स देखिया छैन, तर त्यो salmon pink plaques चाहिँ देखिरहेको छ है. यसमा चाहिँ अब पेशेन्टको एकदम धेरै रेडनेस देखिया छ. In this lesion you can see that it is अघिको salmon pink भन्दा पनि redness बढी छ, scaling अलिक कम छ है. But this is also a lesion of psoriasis. Now here this is a typical distribution. यो extensor यताको aspect जुन छ, normally psoriasis चाहिँ extensor aspect मा हुन्छ, knees मा हुन्छ, elbows मा हुन्छ, shin मा हुन्छ. यहाँ typical knees मा you can see plaque shiny छ, scales त्यति धेरै देखाएको छैन, यहाँ चाहिँ already scales silvery white scales देखिरहेको छ. Here you can see that typical pink plaques, silvery white scales, raised lesions, and this is a typical psoriasis आइरहेको छ है. अब यो भने चाहिँ गटेड सोरियासिस, अघि मैले भनेको थिएँ नि बच्चाहरुमा बढी देखिन्छ, युजुअली थ्रोट इन्फेक्सनले प्रिडिस्पोज गर्छ, थ्रोट इन्फेक्सन पछि आउँछ. यसलाई चाहिँ यो गट्टा भने चाहिँ रेन ड्रपको शावर जस्तै मल्टिपल सानो सानो सिर्का तर पुरै बडी भरि हुने है. सो यसलाई चाहिँ शावर अफ रेन ड्रप लाइक लिजन्स भन्छ, usually seen in children and usually after a throat infection. So you can see raindrops and these lesions look like raindrops spread on it. Inverse psoriasis, normally अघि मैले भने नि psoriasis the extensor aspect मा हुन्छ, knees मा हुन्छ, elbows मा हुन्छ. So when they come in like flexural space जस्तो genital मा आउँछ, काखी मा आउँछ, अरु cubital fossa, popliteal fossa, यस्तो खाले flexural space मा आउँदाखेरि चाहिँ त्यसको स्पेसिफिक नेम हुन्छ इन्भर्स सोरियासिस, मतलब नर्मल सोरियासिस भन्दा उल्टा. So inverse psoriasis भनेर भन्छ है. So that is known as flexural psoriasis or inverse psoriasis. It's not very common. Most common forms of psoriasis अघि मैले देखाए जस्तो त्यो plaque, यस्तो खाले plaque जो normally knees मा हुन्छ, elbows मा हुन्छ, scalp मा हुन्छ. So that is the most common form of psoriasis. This is rare. Erythrodermic पनि एकदम rare. Neglected patients जस्तै वर्षौंदेखि psoriasis छ, धेरै ठाउँमा आइरहेछ, दबाई कहिले खान्छ कहिले खाँदैन, neglected condition मा बसिरहेको छ, त्यस्तो पेशेन्टहरु चाहिँ कहिलेकाहीँ एकैचोटी हामी कहाँ इमर्जेन्सीमा अथवा ओपीडी मा चाहिँ यसको पुरा बडी रेड भएर प्रेजेन्ट गर्छ है. यो चाहिँ एकदम स्किनको लागि चाहिँ इट्स कन्सिडर्ड एज इमर्जेन्सी फर द स्किन बिकज whole surface of the skin gets involved and erythroderma भन्छ यसलाई. र यो खाले psoriasisलाई चाहिँ erythrodermic psoriasis भन्छ, where the entire the person gets all red top to bottom है. अनि यसमा स्केल्सहरु नर्मल psoriasis भन्दा कम हुन्छ, तर पुरै छाला चाहिँ रेड भएर there's a failure, the skin is starting to fail everywhere because there's a massive amount of inflammation going on है. अब अर्को एकदम इमर्जेन्सी स्किनमा हुने इमर्जेन्सी चाहिँ यो पस्चुलर psoriasis हो. This also looks very dangerous and this can actually take life right. Both erythrodermic psoriasis and pustular psoriasis can be life threatening. They are very rare, very rare. कति जना हामीले psoriasis भएको पेशेन्ट देख्छौं, तर एकदम रेयरली नै मान्छे pustular psoriasis अथवा erythrodermic psoriasis फेज मा जान्छ. But when this happen, they can be life threatening. So pustular psoriasis मा चाहिँ कस्तो हुन्छ नि पुरै जिउ भरि सानो सानो पसको दाना, everywhere you will see these small pustules coming. अघिको जस्तो redness, scaliness, यो के भन्छ silvery white scalesहरु सबै हटेर अब चाहिँ सबैतिर पसको सानो सानो दाना हुन्छ. अनि कतिपय ठाउँमा चाहिँ यो पसको दानाहरु एक अर्कासँग जोडिएर दे फर्म लाइक लेक्स अफ पस पनि फर्म गर्न थाल्छ. अब यो यहाँ पनि फर्म भइराछ, यहाँ फर्म भइराछ, यस्तो सानो सानो लेक्स अफ पस भयो भने चाहिँ त्यहाँबाट पुरै स्किन उत्रेर जान थाल्छ and then when the patient starts losing skin you start losing a barrier मतलब आफ्नो they start losing a barrier to the environment. There is a lot of infection, inflammation, or धेरै चीज हुन थाल्छ. Patient becomes very sick when pustular psoriasis develops. So what predisposes to this pustular psoriasis is normally skin मा चाहिँ कस्तो हुन्छ नि most of the people feel that most of the skin disease needs some kind of steroid for treatment, and sometimes low level practitioners or by mistake somebody or just pharmacy बाट चाहिँ मान्छेले आफै steroid किनेर oral steroids किनेर खान्छ. Psoriasis मा oral steroids खायो भने initially त ठिकै हुन्छ, but after you leave steroids, once you leave steroids you can develop a massive outcome. यो pustular psoriasis develop हुन सक्छ. सानो पहिला plaque psoriasis भइरहेको मान्छेहरुमा पनि स्टेरोइड खायो र स्टेरोइड त्यसपछि छोड्दाखेरि चाहिँ pustular psoriasis डेभलप हुन सक्छ. त्यसैले हामी psoriasis मा चाहिँ normally oral steroids चाहिँ except for certain conditions कहिले पनि दिदैनौ, and you should never prescribe oral steroids for patients with psoriasis unless and until there are some very like rare conditions where you give, otherwise you should never give, right? नत्र भए छोड्दाखेरि यस्तो खाले एकदम डरलाग्दो pustular psoriasis हुन सक्छ. त्यो बाहेक प्रेग्नेन्सीमा कहिलेकाहीँ pustular psoriasis हुन सक्छ. एकदम धेरै स्ट्रेस भयो, इन्फेक्सन्सहरु भयो, अनि these can also predispose pustular psoriasis. You should remember that most important causes drugs, especially leaving steroids, and pregnancy. These are the risk factors for developing pustular psoriasis. Now there are types हुन्छ कहिलेकाहीँ सोध्न सक्छ exam मा है, what are the different types of pustular psoriasis, especially general pustular psoriasis, which also has a very fancy name because in dermatology there are a lot of fancy names. So pustular psoriasis of von Jumbush भनेर भन्छ है. So this is a generalized pustular psoriasis, which is a classical form of pustular psoriasis. Another is pustular psoriasis of pregnancy. त्यसको अर्को नाम चाहिँ pemphigus herpetiformis पनि हो. कहिलेकाहीँ यो दुईटै नाम people, your examiners might ask what is pemphigus herpetiformis, and you might think it is some kind of pemphigus bullous disorder भनेर, but pemphigus herpetiformis is another name for this psoriasis, right? यो pustular psoriasis of pregnancy. त्यो बाहेक acrodermatitis continua of Halopew, palmoplantar pustulosis, there are certain names you should remember them. Exam मा चाहिँ कहिलेकाहीँ viva exam मा चाहिँ what are the different types भनेर they can ask you. त्यो बाहेक based on sites, this is very easy to remember. Scalp मा मात्र कसैलाई छ भने scalp psoriasis, हात खुट्टामा मात्र छ भने palmoplantar psoriasis, नङमा मात्र छ भने nail psoriasis, अघि मैले भने जस्तो flexures मा मात्र छ भने flexural or inverse psoriasis, अनि कहिलेकाहीँ चाहिँ psoriasis skin मा मात्र नभएर bones मा पनि effect भएर present गर्न सक्छ. So sometimes psoriasis patient can actually end up with ortho people, right? So that is known as psoriatic arthritis. And so based on clinical presentation, like I said, टाउकोमा भयो भने scalp, हात खुट्टामा भयो भने palmoplantar, नङमा भयो भने nail, flexures मा भयो भने flexures, or if they are presenting only with orthopedic complaints, then it is known as psoriatic arthritis. So typical scalp psoriasis चाहिँ यस्तो हुन्छ है. अघि मैले भने जस्तै light salmon pink patches हुन्छ, त्यसमा silvery white scales हुन्छ, अनि well defined हुन्छ. psoriasis को plaque को एउटा एकदम interesting component चाहिँ well defined हुन्छ, अनि यो र dandruff or seborrheic dermatitis मा कसरी छुट्याउने भन्दाखेरि seborrheic dermatitis चाहिँ जहिले पनि hair मा मात्र limited हुन्छ, अनि कहिले पनि यस्तो well defined boundary हुँदैन, जबकि psoriasis चाहिँ hair को margin भन्दा तल पनि extend गर्न सक्छ. Like you can see neck सम्म आइरहेको छ, forehead को पनि यहाँसम्म आउन सक्छ, अनि this always has a well defined boundary है. Even टाउको भित्र पनि psoriasis को plaque चाहिँ एक ठाउँमा मात्र हुन्छ, जबकि dandruff or seborrheic dermatitis is spread all over the scalp. Now this is palmoplantar psoriasis. यो चाहिँ often hand foot eczema सँग confused हुन्छ. यो पनि well defined हुन्छ, हात खुट्टा दुवैमा हुन सक्छ. It's also one thing that's pretty common, and it's very difficult for the patient because it affects their daily lives a lot. This is nail psoriasis. Findings of nail psoriasis are important. यसलाई चाहिँ यो मोटो भएर जानेलाई चाहिँ subungual hyperkeratosis भन्छ. मतलब nail को मुनि मोटो छाला भएर जानेलाई subungual hyperkeratosis भन्छ. यो सानो 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 धुलो नङमा देख्नुलाई पिचिङ भन्छ. pitting is one of those classical findings of psoriasis. Like, pitting देख्यो भने one often thinks psoriasis हो कि भनेर. So pitting धेरै चीजमा देख्न सक्छ. Like you can see pitting in alopecia, you can see pitting even sometimes in lichen planus. But psoriasis को लागि चाहिँ it's considered more classical, but doesn't mean that if you see pitting in the nails, it's definitely psoriasis, but it's considered more possible, right? यो बाहेक यसलाई oil drop sign भन्छ. यो MCQ तिर सोध्छ. यो बिचको एरियामा जुन यो yellowish orangish ह्यू देखिरहेको छ नि, oil drop sign भनेर भन्छ. यसलाई onycholysis भनेर भन्छ, distal onycholysis भन्छ. So these are features, nail findings of psoriasis. Psoriasis patient को जुन अघि nails मा छ subungual hyperkeratosis, pitting, oil drop sign, distal onycholysis, these are all nail findings of psoriasis. Another thing that comes again is psoriatic arthritis. So most of the patients who have psoriasis, 70% will come to derma OPD because they only have skin lesions. Now 20% of the patient may say the first manifestation can be joint pain, and 10% of the patient can have both joint pain and psoriasis from the start. So people with psoriasis often ask you, is there any effect? Something serious can happen after psoriasis. Most of the time, psoriasis is not life-threatening, nothing, and it does not affect any other systems much. But psoriasis can be associated with arthritis, and that arthritis can be really troublesome for some patients, right? So this is known as psoriatic arthritis. Typical joints involved जुन हुन्छ psoriatic arthritis मा त्यो भनेको यताको joint भयो, यो cervical joint भयो, sacroiliac joint भयो है, अनि त्यसपछि त्यो बाहेक यो distal knuckles हरुको सानो joints जुन involved हुन्छ. This is very common. So mainly your central spinal joints र त्यो बाहेक यो distal joints. त्यो बाहेक it can affect other knees, affect गर्न सक्छ, खुट्टामा affect गर्न सक्छ, elbows affect गर्न सक्छ, shoulders affect गर्न सक्छ. But your spinal joints, sacroiliac joints, cervical joints, अनि त्यसपछि यो हातको सानो सानो joints, these are very typical of psoriasis. अनि हातमा especially कसैको nail psoriasis छ, if the nails are involved, distal nails are involved छ भने चाहिँ distal यो DIP, distal interphalangeal joints पनि involved हुने सम्भावना एकदम हाई हुन्छ. And distal interphalangeal joints को arthritis is very classical of psoriatic arthritis, right? It's considered one of the most classical signs seen in psoriatic arthritis. Now you can see in this picture, यो मान्छेको nails मा कति धेरै affected छ. So you can see subungual hyperkeratosis भइरहेको छ. यहाँ त्यो oil drop sign you can see, most probably pitting the process छ होला यस्तो नङमा. But in these kind of patients, नङको एकदम धेरै affect हुन्छ. नङसँग यतापट्टिको distal interphalangeal joint is also nearby. Most of these patients can also have DIP involvement, right? And यो औँला जुन देखाएको छ नि, यसलाई sausage finger like appearance छ. यो औँलालाई चाहिँ dactylitis, this is known as dactylitis or inflammation involvement of the entire finger, right? So here you can see dactylitis, and dactylitis is also seen in psoriatic arthritis, distal interphalangeal joint involvement, nonco involvement, dactylitis, typical picture of a psoriatic hand. So this is the classification of psoriatic arthritis: asymmetrical oligoarthritis, DIP, symmetrical oligoarthritis, spondylitis, and arthritis mutilans. यसमा सबैभन्दा common चाहिँ asymmetrical oligoarthritis भनेको कहिले यो joint दुखाएछ, कहिले त्यो joint दुखाएछ. सबैभन्दा classical भनेको यो DIP involvement र सबैभन्दा dangerous भनेको चाहिँ arthritis mutilans. This can be debilitating to the patient. So this is the classification of psoriatic arthritis, and sometimes it is asked in examination. Next we come to histopathology of psoriasis. Normally our psoriasis, how do you prove that a patient has psoriasis? एउटा त यो classical clinical हेरेर गर्ने diagnosis हो है. Clinically it appears like that, so you can just make a clinical diagnosis. This is psoriasis if there's that pink skin and there are those silvery plaques. But sometimes there is confusion. अब hand eczema हो कि psoriasis हो कि यस्तोमा चाहिँ biopsy पनि लिनुपर्ने हुन्छ, skin biopsy है. Skin biopsy मा there are certain findings which is again typical of psoriasis. Now in this biopsy picture you can see that यो भने चाहिँ stratum corneum हो. यो माथिको जुन layer छ नि pink color को, dark pink color को, this is stratum corneum. यो भने epidermis हो. Of course, stratum corneum is also part of epidermis, but this is like stratum corneum. This is the epidermis below the stratum corneum, and this is the dermis. Now there are some things that are very obvious. Stratum corneum even normally skin mein yati mota hudaina. Now you can see that there is the stratum corneum has thickened. Now this thickening of stratum corneum is known as hyperkeratosis, right? Keratin stratum corneum ko keratin bodiosis le hyperkeratosis. Normally stratum corneum ko jun cells haru huncha corneocytes huncha तिनीहरुमा न्यूक्लियस प्रेजेन्ट हुँदैन तलबाट माथि जाँदाखेरि न्यूक्लियस लस भइसक्या हुन्छ तर सोरियासिसमा चाहिँ एकदम फास्ट स्किन प्रोलिफरेट गर्छ स्किन ग्रोज भेरी फास्ट द्याट्स व्हाई त्यो मोटो हुन्छ है सो बिकज इट इज ग्रोइङ सो फास्ट द corneocytes don't have time to lose their nucleus. So the nucleus is still present in them. And you can see that these blue dot they has and you see nucleus of stratum corneum corneocytes. Now that is known as parakeratosis. The nucleus present in stratum corneum that is known as parakeratosis. So stratum corneum dekhne changes bane parakeratosis, hyperkeratosis, right? Ani aba yo talako jun epidermis cha yo pani moto bhasa hai thick bhasa. Now you thick hunulai chai acanthosis भनेर भन्छ यहाँ hyperkeratosis भने जस्तै यहाँ चाहिँ acanthosis भन्छ नर्मली जुन रेटिरिजेस हुन्छ नि रेटिरिजेसहरु पनि दुई चारवटा यसो सँगै जोडिया छ क्लबिङ भएको छ सो दिस क्लबिङ अफ द रेटिरिजेस यसलाई चाहिँ क्लबिङ अफ द रेटिरिजेस भन्छ एक दुसरासँग एउटा दुईटासँग जोडिन्छ है जोडेर कहिलेकाहीँ यो खुट्टालाई चाहिँ दिस appearance is known as camel foot appearance. Back, if you go to the dermis, you see that all these blue dots are present. You want to say them there lymphocytes or inflammatory cells are present. Your lymphocytes are mathi area, stratum, epidermis are present. So there are a lot of neutrophils present even in the epidermis, and they are known as spongiform pustules of Kohos or micromonopsis, depending on where it is present. Right? Mathi bhane euta naam sthala bhane arko naam cha. Ani koi ठाउँमा चाहिँ यो papilla यो चाहिँ अब रेटिरिजेस भयो यो डर्मल प्यापिला भयो डर्मल प्यापिला सो थिनिङ सो the suprapapillary thinning अनि यहाँ आर्टरीजहरु पनि ठुलठुलो भएको हुन्छ सो यु शुड रिमेम्बर सर्टेन फिचर्स एक दुईवटा एकदम क्लासिकल हुन्छ हाइपरकेराटोसिस अग्यान्थोसिस क्लबिङ अफ द रेटिरिजेस suprapapillary thinning अनि त्यो suprapapillary thinning भएको ठाउँमा tortuous arteries there are certain 5-6 points you should remember कि psoriasis को histopathology मा के हुन्छ भनेर skinma ekdam dherai psoriasis is something that everybody expects ki you should know something about psoriasis so it's an important topic and you should know at least 5-6 lines on histopathology ke yesto huncha bhanera right so agi मैले भने नि यो रेटिरिजेस हरु चाहिँ क्लब्ड हुन्छ नर्मली त सिंगल रेटिरिजेस हुन्छ तर क्लब्ड भएपछि यसलाई चाहिँ camel foot appearance भन्छ So this is the camel foot appearance of this psoriatic retinosis, right? So यहाँ चाहिँ त्यो अघि मैले जे एक्सप्लेन गरे त्यो सबै यहाँ लेखा छ. So this is a test. This is a bedside test that is done in psoriatic patients, and this is known as the Auspich test. यसमा चाहिँ के गर्छौं भने हामी एउटा ब्लेड लिन्छौं अनि ब्लेड लिएर त्यो psoriasis भएको स्किनलाई खुर्किन्छौं है. त्यो खुर्किँदाखेरि चाहिँ क्यान्डल व्याक्स जस्तो त्यो माथिको स्केल चाहिँ व्याक्सी भएर त्यो पत्र निस्किन्छ त्यसलाई चाहिँ क्यान्डल साइन भनेर भन्छ है त्यो व्याक्सी निस्किनलाई चाहिँ क्यान्डल साइन भनेर भन्छ अनि त्यो खुर्किँदै गएपछि तलबाट चाहिँ यसको पिन पोइन्ट हेमोरेज पिन पोइन्ट डट्स अफ ब्लिडिङ हुन्छ नाउ दैट पिन पोइन्ट डट्स अफ ब्लिडिङ इज नोन एज ऑस्पिच साइन सो यो पिन पोइन्ट डट्स चाहिँ किन देखायो भने माथिबाट जुन हामी खुर्किँदै गयो नि त्यो स्केल खुर्किँदै गए चाहिँ यो हाइपरकेराटोसिस भएको स्केल्स खुर्किरहेको हो but ultimately you reach a point अनि suprapapillary thinning भएको ठाउँमा त यहाँ blood vessels हरु यहाँ टन्न like tortuous dilated vessels हुन्छ त्यसमा अलिकति निक भएपछि त्यहाँ चाहिँ ब्लिडिङ देखिन थाल्छ so Auspich sign is because of this suprapapillary thinning and dilated blood vessels that are present here okay so for today's class we have discussed what are the types of psoriasis where are the sites where psoriasis occurs what is the pathogenesis or what are the different factors that can cause psoriasis histopathology kasto huncha bedside test ke ho है so clinical aspects huncha ni diagnosis सँग related history सँग related that we have discussed today and this is where we end भोलिको क्लासमा चाहिँ we will talk about what are the treatment options how can we treat in psoriasis okay so you guys have any questions for today's class Okay, questions, sir? So then we'll end the class, right? So somebody has asked this sign of Hodgkin. This is also jab त्यो candle wax sign garda garde, when you see a line appearing, that is known as sign of Hodgkin. It is not usually asked. You sign of Hodgkin so usually asked हुँदैन. Usually we just ask what is auspice test and candle sign, and then last मा गएर त्यो pinpoint drops हुनुलाई चाहिँ auspice sign भनेर भन्छ. यो सो बेसिकली यो क्यान्डल साइन चाहिँ यो स्ट्रेटम कर्नियमहरू निस्किँदाखेरिको देखिने साइन हो. त्यो भन्दा माथि एपिडर्मिसको जुन थिन लेयर निस्किन्छ नि त्यसलाई चाहिँ साइन अफ हचेन भन्छ. त्यसभन्दा तल जुन यो डाइलेटेड ब्लड भेसल्सहरू भाषा आउँछ सुपरा पेपिलरी थिनिङ भएर ब्लड भेसल्सहरूलाई हामीले निक गर्न थालेपछि यो चाहिँ एउटा शाइनी मेम्ब्रेन जस्तो हुन्छ कि ठ्याक्क त्यो सुपरा पेपिलरी हामीले क्यान्डल व्याक्स साइनको त्यो स्केल्स हटाएपछि तल गएर एउटा मेम्ब्रेन जस्तो देखिन्छ. त्यसलाई बुस्किज मेम्ब्रेन पनि भन्छ. द्याट लुक्स भेरी शाइनी. सो इफ यु रिमुभ द्याट मेम्ब्रेन अल्सो त्यसको तल अस्पिस साइन देखिन्छ. त्यो शाइनी मेम्ब्रेन भएको ठाउँलाई चाहिँ साइन अफ हचेन भनेर भन्छ है. सो somebody else has some other question? Local area ma psoriasis ko naam. Oh, the local name for psoriasis, skin ko lagi in Nepali ma there is hardly any name. So normally I tell the patients to call it psoriasis only. There's not no specific name for psoriasis that I have yet come across. Some people call it katle rog. Katle rog bhanera pani katile chai bhन्छ है किनकि कत्ला कत्ला बडी निस्किने भन्दाखेरि some people refer to it as katle rog also. Any other question? So I'll end today's class. See you all tomorrow.